Good day everyone, we are Group 2 here to present two important chapters, Chapter 17 Mobility and Chapter 26 Rehabilitative and Restorative Care. I am Dela Cruz and together with me are my group mates, Miss Bigornia, Miss Cabalida, Miss Catudio, and Miss Cruz. So now before we start, let us watch a very short clip regarding the aging musculoskeletal system.
Geriatricians like Dr. Brandon Verdorn see the wide range of effects of chronic pain on older patients.
Anything from sleep disturbance to low mood, social isolation, functional limitations.
Minor, short-lived pain can be managed at home with ice, heat, or over-the-counter medication. If you have severe pain, persistent pain, or pain that affects function, you should see your healthcare provider to determine the underlying cause and develop a pain management plan.
That oftentimes involves non-medication strategies.
That might mean physical therapy, exercise, massage, or acupuncture. Medication strategies often are used too, typically starting with lower risk approaches like acetaminophen and topical medications, and reserving higher risk medications for more difficult cases.
Talk to your healthcare provider, work with them to figure out what's causing the pain, and go through that process of trying different management strategies.
For the Mayo Clinic News Network, I'm Jason Howland.
As portrayed in the video, musculoskeletal issues can profoundly affect an individual's independence, especially for older adults. Now these chapters, Chapter 17 and Chapter 26, delves into the pivotal role of healthcare professionals in mitigating these challenges.
As our musculoskeletal age, it leads to a decline in muscle mass, strength, endurance, and joint flexibility, making movement more difficult and tiring for older adults. Additionally, many experience chronic health conditions such as arthritis, heart disease, or respiratory issues that can further limit mobility, cause pain, and contribute to fatigue. Despite these age-related changes, maintaining an active lifestyle remains important. Regular physical activity supports respiratory, circulatory, and musculoskeletal function while promoting mental sharpness and improving mood. As previously discussed, aging brings gradual changes to musculoskeletal system, which can make movement increasingly difficult for older adults. In addition to these physical changes, psychosocial factors such as the loss of loved ones, retirement, financial struggles, poor health, and relocation can limit physical activity by reducing social interaction and disrupting routines, leading to a more sedentary lifestyle and worsening musculoskeletal decline. As nurses, we can promote musculoskeletal health, but first it is important to remember that a decline in musculoskeletal function can affect not only older adults but also younger individuals. Modern lifestyle habits, such as relying on escalators, elevators, automobile, and spending long periods watching television or using social media for recreation, have made physical inactivity more common. To address these, we can promote musculoskeletal health by encouraging regular weight-bearing exercises, daily stretching, proper posture, and the use of ergonomic practices and a balanced diet. An effective exercise program should focus on three areas: cardiovascular endurance, flexibility, and strength training. First is the cardiovascular endurance. Cardiovascular endurance is improved by activities like walking, jogging, swimming, or aerobic dancing. This exercise need to be long enough to strengthen your heart and lungs. Aim for at least 55% of your maximum heart rate and maintain it for at least 20 minutes 3 times a week. Next is flexibility. Flexibility keeps muscles and joint moving easily. It is best to stretch for 5 to 10 minutes both before and after exercise to stay flexible and reduce muscle soreness. Major muscle groups like the legs, back, chest, and shoulders should be stretched at least twice weekly. Last is strength training. It involves resistance exercise like lifting weights or doing bodyweight movement such as push up and pull up. To develop muscle effectively, a muscle group should be worked with 8 to 12 repetitions, and it is done at least twice a week with gradual increase in workload over time. Next is the mind-body connection. As people age, reduced motivation for physical activity can lead to immobility, poor circulation, fatigue, and low mood. Encouraging age-appropriate exercise can help improve circulation, boost energy, and support mental health. Activity should be paced slowly and adjusted to fit the individual's abilities, promoting for both physical and psychological well-being. Nurses can help by creating personalized activities based on the client's interests and abilities. Hobbies like gardening, dancing, or music can boost engagement and mental stimulation. Below are the exercises that a client can do while in bed and while sitting to improve their physical health and mobility. Prevention of inactivity and nutrition promotion in older adults. Inactivity in older adults can lead to physical decline, weakness, and loss of independence. Staying active is important as it improves the muscle strength, balance, mood, and cognitive function. Regular engagement in daily tasks and social activities also help boost the motivation and overall well-being. Proper nutrition, especially sufficient intake of calcium and protein, is vital for maintaining bone and muscle health. The recommended calcium intake is 1,000 milligrams per day per individual on estrogen therapy and 1,500 milligrams per day for those who are not on estrogen. Caregivers play a key role in supporting older adults by providing encouragement and resources that promote the engagement and healthy living. Barriers such as fatigue, pain, and chronic illness are common but can often be overcome with personalized tailored and consistent motivation.
Inactivity can lead to reduced pulse rate, muscle strength, and bone density, as well as an increased cardiac workload. It also slows down gastrointestinal motility, metabolism, and lymphatic circulation, which can result in complications such as postural hypotension, pressure ulcers, and constipation. Additionally, inactivity may cause feelings of helplessness and depression and also increase dependency on others. When it comes to gait disturbances, we see different types, such as ataxic gait, which is the uncoordinated walking seen in cerebellar disease, foot slapping, which is common in lower motor neuron diseases, and the Parkinsonian gait, characterized by stoop posture and short, shuffling steps. There's also a hemiplegic gait, which is a one-legged jog often seen in stroke patient, and spastic gait, which includes stiff, jerky movements as seen in conditions in multiple sclerosis. So, common musculoskeletal conditions include fractures, osteoarthritis, rheumatoid arthritis, and gout. There's also podiatric conditions like calluses, corns, and bunions. In terms of fractures, you'll often see callus fracture, which is a break at the distal radius, femoral neck fractures, which is common in older women, and compression fractures, which is often from falls or lifting. So, to prevent fractures, it's essential to avoid risky movements like climbing, rise slowly to prevent dizziness, and use supportive shoes. Nursing care for fractures include immobilizing the site, promoting early mobilization, and preventing complications such as ulcers, thrombosis, and as well as contractures. Osteoarthritis is a condition where the joint cartilage deteriorates over time and is most common in people over 55, particularly in women. It's the leading cause of physical disability in older adults. Unlike rheumatoid arthritis, osteoarthritis doesn't involve systemic symptoms. The imbalance between destructive and synthetic elements in cartilage leads to joint changes. Risk factors include overuse, trauma, obesity, and low vitamin D levels. Symptoms include the crepitation, which is a grating sound, hyperdense nodes, which is the bony growths on fingers, and pain, the worst with damp weather or extended use of the joint. So for managing osteoarthritis, acetaminophen is the first choice for pain relief, along with physical therapies like Tai Chi and aquatherapy. Heat and ice are also used for pain relief. When conservative measures doesn't work, joint replacement surgery or arthroplasty is considered, especially for hips and knees. However, it's not recommended for patients with joint infections or those who are obese. Post-surgery patients are high risk for deep vein thrombosis and infection, so medications like warfarin may be used. Patients must be educated about weight-bearing limits and rehabilitation. For chronic pain, we assess pain using the scale of 0 to 10 and help manage it through analgesic and heat or cold therapy. We also educate patients about the activities that triggers or relieve pain and encourage relaxation techniques like guided imagery. In terms of impaired physical mobility, we focus on improving joint function through range of motion exercises and physical therapy. We also ensure the patients avoid overloading joints and provide support for safe ambulation. For self care deficit, we assess the patient's ability to perform daily activities like eating, bathing, and dressing, and also encourage the use of assistive devices like modified utensils or dressing aids. So, rheumatoid arthritis is an autoimmune disease that causes chronic inflammation in the joints. So, it affects adults ages 20 to 40 and is more common in women and those with a family history of the condition. The inflamed synovium can lead to joint deformities causing significant pain, stiffness, and also swelling, and systemic symptoms like fatigue, fever, and anemia. Management includes NSAIDs, DMARDs, which is methotrexate, for example, and corticosteroids to reduce inflammation and pain. If function is severely impaired, joint replacement surgery may be necessary to restore joint function.
Now let's move on to osteoporosis. So osteoporosis is a metabolic bone disease common in older adults characterized by decreased bone mass and density. These are caused by poor calcium intake, excessive loss or poor absorption of calcium. So this weakens the bones without symptoms until fracture occurs. So the causes and the risk factors are the following. First is the inability or immobility. This causes mineral loss in bones, diseases like Cushing syndromes. Hyperthyroidism disrupts bone metabolism. So hormonal changes like reduce in estrogen and androgen levels, especially to women who's undergoing menopausal, lowers bone density. Poor diet like the low intake of calcium, vitamin D and C as well as protein worsens the absorption. And last but not the least, certain drugs like heparin, furosemide, corticosteroids, and thyroid supplements causes bone loss. So now let's move on to the key risk factors of osteoporosis. Of course, age. Women of 65 years old and above and men of 80 years old and above. Ethnicity, specifically those white women of Northwestern Europe. Estrogen deficiency and multiple pregnancies. Smoking and alcohol use. Calcium and vitamin D deficiency. People with small body frame. Mobility, and last but not the least, family history of osteoporosis. For the symptoms and diagnosis, this causes kyphosis, reduce in height, and as well as fractures. So the diagnosis uses bone mass measurements via DEXA or the dual energy X-ray absorptiometry or other scanning techniques. So for the treatment, of course, calcium and vitamin D supplements are important as well as calcitonin, medications like biophosphonates and SERMs, or selective estrogen receptor modulators, and diet rich in calcium and protein. For the nursing intervention and prevention, of course, health education about the adequate intake of calcium through diet, exercise like walking, brisk walking, and other weight bearing exercises, lifestyle changes like avoiding smoking, avoiding intake of alcohol, caffeinated drinks, and salty foods. And for the home safety, preventing falls through right posture and using lifting techniques as well as having a safe environment. And last but not the least, using a rubber soled low heeled shoes. So now let's move on to gout. Gout is a metabolic disorder where uric acid crystals accumulate in joints, causing pain, swelling, and redness. So severe attacks of gout can cause severe pain that can last up to weeks up until months. So management of this would be a low purine diet, specifically low intake of seafood since they have a high purine content, avoiding alcohol as well as maintaining hydration and using medications like colchicine and allopurinol. So now for the pediatric conditions, food problems are very widespread among older adults. That's why podogeriatrics was made, or the um, management and prevention of food condition of adults. So these are caused by aging as well as chronic illness that was mentioned earlier, like the um, osteoporosis, hyperthyroidism, etc., and gait changes and loss of fat pad in the foot. So, nursing care involves the education on hygiene, proper footwear, nail care, and seeking for professional help. So now for the common foot disorders, the calluses, which are caused by friction and pressure forming thickened skin. They are not really painful, however, they can be very risky if removed improperly. For the treatment, it should be moisturizer and avoiding self-removal of the callus. For the corns, these are the cone-shaped thickened skin on bony prominences causing pain due to pressure. For the management, use of U-shaped pads and avoid circulation restricting remedies. For the bunions or the hallux valgus, these are bony prominence on side of foot due to misalignment of the big toe, common in women since they tend to wear tight shoes. Bunions are also hereditary. So for the treatment, stretchable or custom shoes, as well as surgery in severe cases. Next is hammer toe or digiflexus. These are deformity causing the big toe to bend at joints, often forms corns that causes discomfort. Management would be orthotics or surgical correction. So orthotics are use of medical devices that correct deformities. Then last but not the least would be the plantar fasciitis from the word itself. It is the inflammation of the plantar fascia, a ligament causing heel pain in the morning. For the management, stretching is a must. Ice pack or cold compress as well as orthotics and elevation of heel is very important. So for the common foot infections, we have onychomycosis, fungal infection of the nail or nail bed causing thick, brittle, discolored nails, as you can see on the picture below. The treatment would be antifungals, but it is often hard to treat. Next would be the tinea pedis or the athlete's foot. It is a fungal infection causing itching, redness, cracking, and skin breakdown, as you can see on the second picture below, which increases risk of bacterial infections due to open wounds. And last but not the least would be the ingrown nails or the onychocryptosis. This occurs due to tight shoes or improper nail trimming. This can also cause inflammation and pain on the foot. For the treatment would be soaking in warm water with Epsom salt or mild soap, antibiotics, and possible of minor surgery.
Musculoskeletal pain is common, especially as we age. It often stems from degenerative changes such as arthritis or tendon damage, affecting areas such as the shoulders, hands, hips, knees, and spines. Now, many people also experience nighttime cramps in the calves, feet, and thighs. Older adults, in particular, tend to feel more joint strain, and their pain can worsen with damp weather. Managing pain is vital for maintaining overall well being, especially in older adults. When pain is left untreated, it can limit self care, independence, and social connection. To enhance quality of life, we should aim to reduce or eliminate pain. Simple heat therapies like warm baths before bed or using blankets to keep limbs warm can ease muscle spasms, reduce nighttime cramps, and support better uninterrupted sleep. Now, when using heat therapy for older adults, it's also important to be cautious as they are more prone to burns. Passive stretching can be a safe and effective way to relieve muscle cramps. And to prevent pain, it's also best to avoid overexertion and known triggers like heavy lifting or damp weather conditions, as I've mentioned earlier. Simple techniques like slow, rhythmic back rubs can help promote relaxation and ease discomfort. For those with joint pain, resting the affected joints, using proper support during transfers, and walking aids like canes or walkers can make a big difference. Maintaining correct body alignments is also key to managing pain. And also, it is essential to handle older adults gently during care, avoiding bumps or rough movements, and to remind all caregivers to use extra care when turning or lifting patients. As mentioned here, unrelieved pain can impact independence and quality of life. So diversional activities can help shift focus from pain. Alternative therapies like acupuncture, acupressure, and chiropractic care, along with guided imagery and therapeutic touch, can support pain control. Now, the goal here is to help patients stay active with minimal pain. Now, to reduce musculoskeletal pain, it is important to maintain good body alignment. And also, supporting the limb near a painful joint while moving or lifting helps minimize discomfort. Additionally, using assistive devices like walker or cane can provide extra support, as I've discussed earlier. Next is preventing injury. As we all know, safety is essential for older adults due to the higher risk of accidents and slower healing. When moving, we must remind them to always be mindful of their surroundings, use railings and canes for balance, wear supportive shoes, and avoid long clothing that can cause tripping. It is also important to safely use heat therapy, making sure to measure water temperature and avoid excessive heat. Warm baths can help relieve muscle spasms, but they may cause dizziness or fainting, leading to serious injuries if not monitored carefully. It is crucial to avoid rough handling, like dropping a patient into a chair or using force to straighten limbs, as this can result in fractures or musculoskeletal discomfort. We must always use gentle handling techniques to ensure safety and prevent unnecessary pain to our older patients. Finally is promoting independence. As we all know based on the video earlier, musculoskeletal problems can significantly impact an older person's independence. Now, as nurses, it's important to help patients minimize these limitations and promote the highest level of independence possible. Using assistive devices like canes and walkers can support mobility, and physical or occupational therapies are key in selecting the right devices based on individual needs. Now, this is the last slide for Chapter 26, Mobility. Now, the next and last chapter to be discussed is Chapter 26, Rehabilitative and Restorative Care for Older Adults. Now, this will focus on helping our older patient regain or maintain physical function, independence, and quality of life after illness, injury, or age-related decline.
So let's first differentiate rehabilitative from restorative care. So rehabilitative care involves therapies that help individuals return to their previous level of function after events such as stroke or fractures. So usually the therapies are developed by the physicians. So this involves services from physical, occupational, and speech therapists, and it is medically ordered. On the other hand, restorative care is provided by the nursing staff without the medical order. So its goal is to maintain or improve the current function, prevent decline, and promote quality of life, especially for those with chronic or irreversible conditions. So this too highlights frailty. So frailty is a common issue in aging marked by weakness, fatigue, and reduced physical abilities. And it is often linked to sarcopenia, which is an age-related muscle loss. So this includes immobility, poor nutrition, and hormonal changes. So frailty increases the risk of falls, disability, and hospitalization. However, early interventions such as strength exercises and nutritional support can help manage or prevent it. So let's now proceed with disability. So disability can occur suddenly, such as from accident or stroke, or it can be progressive, such as having chronic illness. So it disrupts daily life and affects self-image, wherein it often brings multiple losses such as in function, independence, and roles, which may trigger grief responses such as denial, anger, and sadness. So it's a hard adjustment for both the person and their family. So the coping depends more on the attitude and the personality than on the severity of the disability. So being optimistic or an optimistic individual and supportive families can significantly improve the outcomes. In terms of the principles of rehabilitative nursing, it focuses more on these three: increasing self-care capacity, reducing limitations, and assisting when necessary. So the effort should empower patients to regain as much independence as possible. So us nurses must carry out care to each individual, recognize progress, prevent complications, and maintain a positive attitude for them. Let's now proceed with the functional assessment. So when a person suffers from disability, functional status is not just a medical diagnosis, so it guides also or directs rehabilitative care. So nurses can assess two kinds of activities: activities of daily living or ADLs, which explores the skills the patient possesses to meet the basic requirement. And second is Instrumental Activities of Daily Living, or IADLs, which examines the skills beyond the basics that enable the individual to function independently. So the assessment tools that can be used are CATS Index for IADLs and Cleveland Scale for ADLs. So these tools help evaluate disabilities.
Now that would be all for our presentation regarding Chapter 17 and Chapter 26. Again, we are Group 2. Thank you all for listening.